Hello, everyone. My name is Nelson, and today we'll be talking about the importance of infection prevention for healthcare workers. To start, let's talk about the Black Plague. The Black Death was a bubonic plague. It was a pandemic that occurred in Europe between 1346 to 1353. It was one of the most fatal pandemics in human history. 50 million people perished, perhaps 50% of Europe's 14th century population. Bubonic plague is caused by the bacterium Yersinia pestis, and it was spread by fleas, all because they did not practice infection prevention control. Today, in modern society, all healthcare workers practice infection control procedures in hospitals, in the clinical areas, to avoid the risk of contamination and infection. It is a must to maintain infection prevention when dealing with patients. So here are some facts about infection. The Centers for Disease Control and Prevention has estimated that approximately 99,000 deaths occur each year in the USA. Typically, there are between 10,000 and 10 million bacteria on each hand. Damp hands spread 1,000 times more germs than dry hands. When you cough, germs can travel about 3 meters if you do not cover your mouth. And last, bacteria double in number every 20 minutes. So, what is an infection? An infection is when a microorganism or microorganisms, germs, invade part of your body and make you sick. What are these microorganisms? Microorganisms are tiny living creatures that are so small they can't be seen without a microscope. These are many different kinds of microorganisms, including bacteria such as E. coli, viruses such as the rhinovirus, which cause the common cold, fungi such as yeast, which cause yeast infections, and parasites. So, what is infection prevention? Infection Prevention and Control, IPAC, refers to evidence based practices and procedures that, when applied consistently in healthcare setting, can prevent or reduce the risk of transmission of microorganisms to healthcare providers, clients, patients, residents, and visitors. IPC affects all aspects of healthcare, including hand hygiene, surgical site infections, injection safety, antimicrobial resistance, and how hospitals operate during and outside emergencies. So, why is infection prevention important? Without effective infection prevention control, it is impossible to achieve quality healthcare delivery. So, these infection prevention include reduces the number of microorganisms, reduces the risk of transmission of microorganisms to clients, reduces the risk of cross contamination among clients, and it reduces the risk of transmission of infections organisms to oneself. So, among the basic method of infection prevention is hand washing. Healthcare workers should wash their hands with soap and water each time before and after touching a patient. So how to wash hands? So the World Health Organization has instructed us with a standardized procedure to wash hands. So first, wet hands with water. Apply enough soap to cover all hand surfaces. Rub hands palm to palm. Right palm over left dorsum with interlaced fingers and vice versa. Palm to palm with fingers interlaced. Backs of fingers to opposing palms with fingers interlocked. Rotational rubbing of the left thumb clasped in the right palm and vice versa. Rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. Rinse hands with water dry hands thoroughly, and now your hands are safe. So another method is to keep nails short and trim them often. Short nails, natural nails, are less likely to harbor microorganisms, scratch a client, or puncture gloves. Another method is to remove all jewelry. Microorganisms can lodge in the settings of jewelry and under rings, so care workers must remove these jewelries to facilitate proper cleaning of the hands and the arms. Next is the donning of medical gloves. Uh, this is a standard precaution to reduce infection, uh, and this is to prevent transmission of potentially infective organisms from the nurse's hands to the clients at high risk of infection. And lastly are PPE, personal protective equipment, uh, which is to protect yourself and the patient. These include the hairnet, which prevents the contamination of sterile field, falling hairs, and dandruff, a face shield to protect the face from airborne pathogens and droplets, a mask, which protects the healthcare workers from people from respiratory disease, a gown, isolation gown, which protects healthcare workers from microorganisms and bodily fluids, and shoe coverers or um, booties, which protects footwear to prevent spread of pathogens. So this minimizes the exposure to hazards that cause serious workplace injuries and illnesses. It protects both the patient and the healthcare workers. So these are methods as a healthcare worker to really apply these in uh, dealing with our patients um, versus hand washing, removing all jewelry, keeping nails short, donning of gloves, and the PPE. Overall, doing these simple and basic fundamentals of infection prevention control may seem a bit tedious, but it can save a life in the long run. So it is important for us as future healthcare workers and nurses to practice and maintain infection prevention control always in our profession.